वैनकूवर च ब्रिटिश कोलंबिया के सेहत मंत्री एड्रियन डिक्स वालों न्यूज़ कॉन्फ्रेंस की गई। उन्होंने वालों टीकाकरण रोल आउट टीम ते कोविड वैक्सीन बूस्टर खुराकां लई सूबे के दिशा निर्देशों ते एक अपडेट प्रदान की गई। उन्होंने नाल BC के कार्यकारी सूबाई सेहत अधिकारी डॉक्टर मार्टिन लावोई भी शामिल हुए।
As part of today's briefing, we'll be providing an update on the next phase of our immunization plan as we prepare for the fall. People in BC have demonstrated a true commitment to protecting themselves, their loved ones, and community throughout the pandemic by observing public health measures and getting vaccinated in record numbers. It's important to recall that 94% of British Columbians, 94%, have received their first dose immunization from COVID-19. And every time, I want to acknowledge and thank every British Columbian who, when they've been invited to get vaccinated, have got vaccinated and protected themselves and their community. These efforts have saved lives. Not a few lives, not 10 lives, but thousands of lives. And of course, around the world, vaccination has saved many, many more than that. Our number one priority is, was, and will be protecting people, especially those at the highest risk of severe illness or death. That is why BC has followed advice from public health since day one and has implemented measures to protect those living in long-term care, elderly populations, and those who are clinically extremely vulnerable, ensured that these groups of people were and are prioritized for vaccination. Equally as important is protecting our healthcare system capacity. This means ensuring our healthcare workers receive priority access to vaccines to protect themselves and those they provide care for, and reducing pressure on our healthcare system through a robust vaccination program and appropriate public health measures based on the best available evidence. I am proud that in British Columbia, unlike anywhere else in North America, 100% of our healthcare system workers are vaccinated with a primary series of COVID-19 vaccines. We also want to keep our communities safe and bring people back together safely. Thanks to people getting vaccinated in record numbers, we were able to lift social restrictions earlier this year. We continue our work to reduce the impact of this pandemic, protecting our health and our health system. Now is the time to continue this momentum and prepare for the fall. These are and will continue to be, as we continue to live in this pandemic, challenging times, challenging for our healthcare system and challenging for people around BC. We've gone through multiple phases and together implemented different strategies to address COVID-19 while protecting critical social interactions. It's why in BC, and we can be proud of this, all of us can be proud of this, we kept schools open when others closed them, because the health and social implications for children were so important. And we're going to continue as we deal with the present circumstances of COVID-19 to do the same thing. And with that, it's my honor to invite Dr. Martin Lavoie to provide further details on vaccinations to date and the science guiding our decisions. To all the healthcare workers and healthcare professionals who have on the ground delivered our vaccination program, to Dr. Ballum and her team, her incredible team of both staff and volunteers who supported this program, people who have worked through the past year in the service industry and who came out and made the customer service of our vaccination campaign so outstanding. And I have to say, I have never seen, in terms of our surveys of people who received the vaccines, so much public support for the delivery of those vaccines. I mean, getting a shot, I take a few every day because I have type 1 diabetes, but getting a shot is not a fun thing, but it is an important thing. And people have different reactions in different circumstances. I think our team has done a fantastic job. I want to speak just to the people who have followed our guidance and got the vaccines when they've been asked to get them, when they've been invited. The 2.8 million people who've got their first booster, their third dose, and that 2.8 million people are obviously strong supporters of the vaccination campaign, and we are very appreciative to them. The message to them today, except for those who are 70 and above and those who are in clinically vulnerable 1 and 2 categories who have immune issues,